We are not only biological. So this aligns to a lot of what we've been hearing.
We know the placebo effect exists. It's actually a problem because for you to approve a new drug, you have to show to the FDA that it is X% better than placebo, and placebo is getting better. So it's getting more difficult to approve. Placebo is not denied by anyone with any awareness of what's going on. It's a growing phenomenon. It's very strong. Even placebo operations of the knee seem to have compelling results, not only sugar pills.
There was this whole study where people went in for fake knee surgery, and the people who got the knee surgery versus didn't get the knee surgery, there was no statistical difference in the result. Repairing a tendon in the knee seems to be something that is extraordinarily physical.
There you go. So we are in a situation in our society today where everybody acknowledges the placebo happens. Nobody's thinking, well, what does it mean then? How can a mental state completely influence the physical state of the body? Well, under cosmopsychism, the body is a mental process. The appearance of that mental process is what we call the body, but everything is mental. So it is no surprise at all for the idealist or the cosmopsychist that the placebo effect is there. It's a necessity. It's exactly what you would expect. But because we deny that something like this should happen, even though we know it does, because it's an empirical fact, we don't even have the immediate next thoughts, which are, how do we use the placebo effect in treatment? Shamans worldwide have been doing this for millennia. Oh, that cigarette smoke blowing and feathers and dancing and screaming. What do you think that is? It's to induce the placebo effect. In the West, until around the middle of the 19th century, most of medicine was the placebo effect. The good doctors were the doctors that had a reassuring bed presence. Those were the good doctors. Years of authority.
I don't know if it's fair to say it's placebo. I think harnessing the power of the mind is functionally significant.
But that's what I'm saying.
But like when I use self-hypnosis, Jonathan loves when I talk about giving birth. When I use hypnosis and I don't experience birth as a traumatic state of suffering from which I need to escape or whatever, that is harnessing the power of my mind, right?
Yes. Yeah, we just happen to call it placebo, which is a sort of demeaning name because it sounds like insignificant, random. And this is a cognitive dissonance in our culture because everybody who is anybody looking into this acknowledges the placebo effect is there, and it's not small even. It's compelling. You know, there are cases in the literature, I'm not sure you could call this placebo, but it goes under the same category, where you could cure warts, talk therapy.
Oh, this is Dr. Amir Raz wrote The Suggestible Brain, and he talks all about these incredible cases. He cured Tourette's syndrome. You know, like these things, because he told this little kid, like, oh, I've got this machine and it can detect when you're going to have a tick. The kid had no ticks anymore. Like, unbelievable.
We have this cognitive dissonance. We know it's there, but we dismiss it and we don't try to explore it. So we look at the shaman as an idiot because there is no way blowing tobacco smoke, shaking feathers, and doing a dance can have causative effect on anything. Well, think again. If the patient believes that it does, then it has. And what is the causative effect? A mental inner state, a mental attitude affects a mental process. And the image of that mental process is the body. There is nothing logical here.
The New York Times, my father just recently sent me an article talking about how it's been observed and studied that the lack of meaning and purpose in someone's life increases cognitive decline.
No surprise to the idealist or the cosmopsychist. We don't exploit these things, and we are comfortably numb because we know the phenomenon is there. Our entire metaphysics tells us it shouldn't be there, but it is, and we don't abandon our metaphysics, and we don't leverage it. And the result of that is that, at least in my country, and I'm very happy for how medicine is practiced in the Netherlands compared to where you guys are. In the Netherlands, it's not commercialized at all, and the idea is minimal intervention. You only intervene when it makes a difference. You don't just intervene for no reason or just because it makes the patient feel better. So I'm grateful to that. There are no commercials about medicines in the Netherlands. It's completely cut away from any notion of profit and commercialization. I'm grateful for that. But today in the Netherlands, you go to your doctor, and only in extremely rare circumstances, your doctor will even touch you. Your doctor will listen to your story and then either will give you some medicines or will order some exams. In other words, this evidence-based medicine, I'm all for it. But we are leaving on the table the greatest value that medicine had until the middle of the 19th century, which was the reassurance of your doctor, the authority of your doctor. What now goes under the name the placebo effect. We don't reassure anyone. According to the law, your doctor has to be completely truthful and honest towards you. So if there is a 0.01% that thing is a cancer, your doctor has to say it may be. That's where we are now. This is where we are. We think the body is a mechanism, and therefore doctors become mechanic. And I think this is a tragedy.